I think it's important to show them the equipment. When I first talked to them about it, I was like, come and have a look, here's the screen, we just sit you down here, here's the microphone, here's the camera, and you'll just see us at the other end. Not usually a lot of problems around that. Other ways it has been used and with patients that we've worked with, but if there's been kind of like a group meeting via telehealth, and patients have feedback that they're not so comfortable with that, where it's a group meeting and a lot of people at the other end. They've not felt so comfortable about that. Or there's a group at their end and at the other end, and it's just, can be a bit overwhelming for them anyway. A more streamlined booking process would make that process a lot easier. Other barriers would be if a patient's not able to get themselves to a site. We would be expecting, if it's in their own homes, these would be people who either have something set up, they understand technology, and a surprising number of older people actually do. Hearing problems is another area that may be difficult, may be more difficult when people need to be sort of closer face to face, and you need to have the volume up. And I mean, if we're careful about how you locate people, should be able to get around that. It does give good quality, good sound quality and good picture quality via the DHB system. But when we've used it, they're more than happy once they get familiar with it. They see that it's an easy way to make contact. Like an example is this Haast family. You know, if it's a long distance away and it's just really going to be impossible for us to arrange a quick catch up, it's going to, take more organisation to actually, for both parties to travel halfway or one to go the full distance, then telehealth's a great option. I think it's a great tool, and I think we would possibly use it more if we could make if the booking process was a bit more streamlined. I think one of the key bonuses of telehealth for us or for our SLT work is to increase frequency, to increase access to our services for the patient, and to increase intensivity or frequency of the contact time that we can provide them, so that we can actually provide a therapy program per se. Doesn't work, it's not appropriate for all patients, but for those that it is, then it's an ideal tool.